day, my name is Princess J.C. Rivera and I will be demonstrating the assessment for the eyes. But first, let me wash my hands and wear the appropriate PPE such as the laboratory gown, the face mask, the head cap, the gloves, and the shoe cover. So I will be now taking my face mask. I have that. And now my gloves. To ensure the patient's safety. And of course, I will be providing a privacy by closing the curtains and the door and ensuring that the patient is comfortable. Ma'am, are you comfortable with your position or do you want me to assess you in a more comfortable position?
No, I'm fine with this.
Okay, you're comfortable with the position. So now I will be explaining the procedure to the patient. Good day, ma'am. My name is Princess J.C. Rivera. I am a student nurse from Dagma Medical School Foundation Incorporated. For verification po, ma'am, may I know your name?
JN Panes.
Wait a minute po, ha? J.N. Panes. Your age po?
18 years old.
18 years old. Your date of birth?
May 8, 2007.
May 8, 2007. So, Ma'am J, and today I will be assessing your eyes, including your visual, your eye structure, and if it's okay with you po.
Yes, it's
Oh,
fine.
it's fine. So, okay, rest assured ma'am that all of the documentation and the findings will be kept confidential po. So now let's start our assessment po.
Okay.
So I will be asking you a few questions regarding of your current symptoms. And this will take a few minutes if it's okay with you po.
Yes po.
So ma'am, kasi po Ma'am JN, do you have any problems with your vision?
Not at all.
Okay naman po. So how about some spots or some floaters in front of your eyes po ma'am?
None so far.
So far. Okay. Yeah. Floaters of eyes. Nice. Then how about some, do you wear glasses or contact lenses also?
None so far as well.
Even anti-red spot?
Yeah, even under-red, I don't wear.
Glasses. Then, do you experience some eye pain, some redness, and also some blurry of vision?
Not so far po.
Okay, that's good to hear po. So, ma'am, I will be performing the visual acuity test. It has a 2 test. It has a Snellen's chart. It has a near vision test, and it has a Ishihara test po, ma'am. So, now let's proceed to Snellen's test. So, I will be providing you a chart here, and I want you to read it 20-inch away from it po. And if you have a prescribed glasses, you can wear them both of your eyes, and if none, then that's fine po. So, can you place po, ma'am, into a 20-inch
Thank you.
So, so can you cover your right eye, ma'am, using this paper po?
Okay.
Please cover your right eye and please read starting from letter E.
E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P. F, E, L, O, P, Z, D, D, E, F, P, O, T, E, C.
And next.
L, E, F, O, D, P, C, T. F, D, F, L, P, E, O. F, E, R, O, L.
So it's okay, ma'am, if you can't read it there.
Okay.
Okay, so can you do it also on your left, if your left eye po, ma'am? Can you cover your eyes and start reading in letter E?
E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P, F, E, L, O, P, Z, D, D, E, F, P, O, T, E, C.
Next.
L, E, F, O, D, P, C, T.
You can't read on those charts.
Yes.
Okay, so as I observed with your Snellen's chart, ma'am, in Snellen's chart, you can read from number 1 up to the 9, but when it comes to 10, in the smallest number, you can't read it. But And as I can see, your eyes is responding naman to the biggest number into the smallest number, not just in the smaller smaller letter po.
Okay.
So, ma'am, can you identify the color of the line 6 po, ma'am?
Yellow.
Okay. How about from line 8 to 9?
Yellow.
Oh, okay. I can see. So, I can also see that your eyes is responding and the color is correct po, ma'am. So, now let's proceed to the near vision test. I will be providing, in the near vision test, it includes the jogger back test that has a 14-inch away from you, just like you're reading a newspaper. And if you have a glasses, you can use it. But if not, then that's fine. So I want you to read it 14-inch away from you and also read it from the smallest letter po here. Okay. While covering your right eye po.
Okay. Please.
Okay.
Cat for look is my end up come play you see the dog my play see two for you. See play come see cat not look dog is my up the 4 2 and you to not dog to you and play cat up is my not come for the look not see my play come is look dog cat to up for not to look my you for the end and is play come you see you to the cat up dog my and dog for up is cat not play look see dog.
Okay. So how about the last side then po, ma'am? Can you start reading from here? Okay.
See play come see cat not look dog is my up the 4 2 and you to not dog to you and play cat up is my not come for the look not see my play come is look dog cat to up for not to look my you for the end and is play come you see you to the cut up dog my and dog for up is cat not play look see dog.
Okay, as I can see in your reading, ma'am, your eyes is responding and can clearly look into the smallest up to the big words po. So can I ask you what number in here you can read while using your while covering your right eyes po? Is it in here po in 6:30 or in 6:24?
6:24.
So okay, so you have a right eyesight po. So now, how about in the left side po? Is it same with?
Yeah, it's the same.
Okay po. So, I will indicate here that you have a clear vision from smallest to the biggest letter. And of course, in an Isichara test map, I will be providing you a chart that has a number on it, and can you please identify the number that has on here, while covering your right eye also.
Okay.
So what number is this, ma'am?
16.
Okay. How about this?
8.
Okay. Then in the left side po, ma'am.
16. 8.
Okay, that's correct. So I can see that we don't have a defect within the color, and also you can read clearly then po. So now let's proceed to the confrontational test. And of course, I want you to cover your right eye as I place my hand here. And of course, please stare at my eyes po, ma'am. Can you stare at my eyes? And if you see my hands coming from your peripheral vision, please stay stop, okay? Okay, 1, 2, 3. Stop. 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 Okay. So how about the left side, ma'am? So I will be pointing my hand here, and if you see it in your peripheral vision, please stay stop, okay? Stop. 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 Okay. As I see, both of your eyes is responding also, and where I place my hand po, and that's good. Now let's proceed to the corneal reflex of the light and the pupillary reaction to light. So both of the pupils must be equal, round, and also reactive to light. And you will also note for some anisocoria and strabismus also signs of symptoms. So now I will be. Can you please look into my timeline po, ma'am, ha? For the corneal light reflex. So, 1. As I observe with your corneal eye po, I see some alignment in your eye eyelids, and also in your eye. Your eyes is symmetrical, or has a symmetry, and there's no weakness of eyes din po. I didn't see some redness also. So now let's proceed to the accommodation. So please follow the distance object, ma'am. As my pen light, please look into my pen light as I move it through the bridge of your nose. I will come forward and also lean back on it din po, ha? Okay. So just look into the pen light lang po. Then okay. As I can see, your eyes is converged and it has a the pupils is constrict po. And of course, I don't see some weakness of your eyes, and that's good po to hear. So now let's proceed to the position test. And for me to be able to assist you with that, I will be using the six cardinal field gaze po. And of course, kindly please cover your one eye po, ma'am. And of course, please just your eyes is moving, mama. Don't move your head and your shoulder also. Just eyes only po. Okay? As I move this, okay. And the left eye naman po, ma'am. I observed, ma'am, that both of your eyes is responding and when on where I put or place the six cardinal gaze. And of course, I can see that there's no weakness also with your eyes. So I will note with that. Now let's proceed to the inspection of the eyes and your eyelids for symmetry. For symmetry, swelling, some redness, and some ability to close it properly. So ma'am, can you just look into my eyes po? Okay. So I can see, ma'am, that your eyelids is evenly distributed, and it has your eyeballs is also globe. It has a firm no tenderness as I see, and there's no signs of swelling and also redness po. Next is I will be documenting it, ma'am. Now is I will be inspecting your sclera, your bulbura, your palpebral conjunctiva for some signs for the color and signs of lesion po. So ma'am, can you look po in the left corner? Right? Yes. I will touch your eyes po, ma'am, ha? How about in the upper po? Okay, I will touch here. Okay. And down po, ma'am. Okay. As I observe for the sclera, your sclera is white naman po, and for the palpebral conjunctiva, I see that there's no jaundice on it. There's no swelling, there's no lesion, there's no signs of cyanosis also. And for the bulbura conjunctiva, I also see that there's no signs of swelling, lesions also. So for the ophthalmoscope, it is used to the inferior of the eyes, to inspect the inferior of the eyes, but we don't have those kind of equipment, so we will not be doing that. So the assessment is now done, ma'am. Thank you for your cooperation. And of course, I'll be washing my hands. And for the documentation po, the patient J.N. Pan is age 18 years old and date of birth May 8, 2007. There's in the visual acuity test, it is normal. She can read properly. For the near vision test, she can read from the smallest up to the big letters or words also. In the Ishihara test, she can indicate the numbers of it, and also in the confrontation, she can also indicate where my hand will point. Same goes to the accommodation test and also in the 6 cardinal test. In the accommodation test, the eyes is converged and the pupil is constrict. So the inspection of the eyes, there's no redness, no swelling also, and also there as eyes is equally distributed. And for the sclera and for the sclera bulbura, it has no signs of jaundice, cyanosis, and swelling and infection. That's all. Thank you.